Hey, how's everybody here doing today? My name is Duncan, and we are Collegiate Health Consulting. And today we're going to be telling you about how you can get a better experience with your university health services department. All right? So I want everybody to look to their left, and then look at the person to their right. All right, now statistically speaking, one of you is supposed to have an STD. Okay? But you wouldn't know that if you didn't go and visit your health department. Now you're all looking at each other like. So without further ado, I'm going to go ahead and we're going to introduce each other.
My name is Evan Green. I'm the Chief Marketing Officer of the company. I have a marketing degree from the University of West Georgia. A few things that I've done since being with the company is I increased the University of Alabama's health center visits when people are actually sick by 67%. I added 6,000 people to the social media pages at UCF, and we have 100% positive reviews and feedback from over 150 colleges all over the country.
My name is Logan Rainwater. I'm the COO of the company, so I do a lot of the oversight. I have a management degree from the University of West Georgia. We've overseen over 50 different colleges and working in this field. I've helped facilitate partnerships with major hospitals around Atlanta and other places like Wellstar and Emory, and then we have increased productivity by over 15% in the colleges we've visited.
Hello, my name is Teran McKnight. I am the Senior Director of Operations. These are just some of the things I've done with the company. I've improved 27 healthcare centers' communications, managed over 20 hospital operations, and increased the effective communication by 35%. I also obtained my bachelor's from the University of Florida.
Hi, my name is Brad Cobb. I'm the President of Client Affairs, so I'm the person that's going to work with the client and make sure they're 100% satisfied. I have a finance degree from UGA. I was also a financing officer for Google and a public relation for Amazon. And I've raised customer satisfaction for 62%.
And as you guys already know, my name is Duncan Covington. I got a bachelor's degree from the University of West Georgia for marketing. And I've oversaw several marketing projects for Apple. I've also worked for Grady Hospital. The whole Atlanta can't live without Grady. That's me. And I increased Emory's health department use by 53%.
So I'm going to talk to you guys about the company background, a little bit about what we are and what we stand for. Our company started in 2005 with our founder, William B. Healthy. He graduated from the University of Heavy Pillar in 2005, where he got a medical degree, and from there he actually decided he wanted to open up his own firm. In his home school, they did not have an on-campus health facility, and he decided he was going to open up his own. After developing that and getting it started, he realized what a good job they had done and how it helped so many people in the college that they decided to start their own. They started their own consulting company, going to other colleges and helping their campuses. So from then on, they have worked with over 300 different colleges across the nation, working with big names like UGA and University of West Virginia, things like that. And now we're here to talk to you guys.
So my name is Evan Green, like I said. I'm going to be going over our statement of need. Can anyone guess how many social media followers the health center has? 60? That's pretty bad. Anybody else? Just any number you can think of. 500. It's 0 because they don't have one. So, as everyone knows, the most effective way to get in touch with people and externally communicate this day and age is going to be social media. Emails and things like that aren't as popular. Flyers and stuff definitely are not. So the first need that we need to fix is the lack of social media. Another thing is you can't externally communicate without being able to get in touch with people. So currently you have to go to their website, you have to find a phone number through a bunch of different tabs and things like that. And we're going to add chat boxes, which is, I don't know if you guys know, it's like the thing when you go on a website and it pops up and says, "How may I help you?" things like that. So you can go to the health center, send in a picture of a cut, or give some symptoms, and you're going to get a quick response. And that's going to help your feeling of availability by the department themselves, because you can quickly go in there, talk to them, and get an answer. You don't have to schedule an appointment, go through a lot of things like that. So that's going to increase the entire feeling of availability and the ability to externally communicate throughout the entire department. In addition to that, which is kind of nice, it's kind of a school-wide thing, it's going to allow for some technical and some marketing internships. So instead of having to pay someone to go in and renovate and do all these extra things, our solutions are just going to be, you can have one of your technology students come in and program that into your website. So it's not that hard. They can write the code. It can be an internship. They can put it on their resume. Same thing with the marketing students. You can have someone come in and run the social media page, have a couple posts a day, do things like that. You don't have to pay for an employee to do that all the time. So you're getting the benefit of increasing your communications, but you're also not having to pay a ton to do that. So I'm going to hand things over to Tyler for communications.
Again, my name is Turan. I'll be going over the internal and external communications. So basically, the health center now just has the basic communications that a lot of people do have: emails, telephone, and sometimes you guys use sticky notes, to leave messages for other employees. So we're going to go over a way I can encourage to use a better tools of communication. So one of the first things I want to go over is creating a communication tool that notifies every staff member instantly, and not just an email, but to your phone. Emails generally are so clouded. You get so many emails a day. So having something separate that is basically just work related will give you actually instant access to messages or anything that you need to notify each staff member. So we would encourage something like a group message or a group app called GroupMe. Would be actually beneficial if you can go on your cell phone, a tablet, a laptop, pretty much any device that you have. Also, with our experience with GroupMe, it actually but outside of work, it actually gives you all a chance to connect with your coworkers and staff members on a personal level. It makes the work environment more better. If you can laugh at someone, tell a joke, in the middle of the day, it kind of bottles down the stress. At the end of the day, this is a serious department. It's for health for the students. So just to give you guys a relief and a more personal connection, a group message that's on your phone or tablet is one of the best ways to go. Over 70% of college health centers have some form of group message to communicate. So it's something that's changing with the times, and we encourage you to look into that and to get into that, because like I said, it's an instant communication. And if you're not here, in the office at work, when you're home and you need a message that's for tomorrow or whatever, you can have it on your GroupMe. You'll be able to more check your GroupMe first than your email, because that's work related versus your email that you probably get from a lot of people every day. Another thing that we encourage is to install a PDA system in the healthcare facility. That will allow you to reach a physician or a nurse when they're not near a telephone, not near a computer, not near a cell phone. Actually, 3 weeks ago, we had an incident at the University of North Carolina, and prior to that, 3 months ago, we installed a PDA system, right? So my nephew goes there, and one of his friends was having an asthma attack, and the physician was able to get to him because he was way in the back room cleaning needles. He was able to get to him through the PDA system. So that was one thing that really struck home, because anything could have happened to him, and then now, that we installed that PDA system, the physician was able to get to him more quickly. And it benefits more than just medical-related issues. You can send reminders and things through a PDA system for any staff member who, if they have to go to lunch, if they need a shipment in or need to transfer things, you can install that as well. And going over the external communications, there's not much up here because there's not much that they externally use, maybe a telephone or through email. But what I've noticed from the analysis that we've got is that students do not receive mass emails from the health center here at the University of West Georgia. And I feel like that would be beneficial if there was to create a mass email, because stuff that changed this year that I've noticed is like the students have to pay for certain visits now that is not included into their fees that they pay. So updates like that would be beneficial for students to know, to be more prepared to when they go to the health center. A lot of times you probably won't get charged when you go there, but it'll go on your account, and then now later down the line, they have trouble registering for classes because they have a hold on their account. For a month ago, they didn't even know when they just went for a simple checkup or to see a doctor about an issue. So that will be beneficial to communicate externally with the students and with everybody else. And here, I want to turn it over to Brad for the recommendations.
So I'm going to be doing the recommendations. And first off, we're going to look at the first appearance and the logo for the health center. So my first appearance with it, when you get to the website, the first thing that you see is about fees. Nobody wants to see fees when they're doing health. So as a student, nobody has money to pay for those fees. So I put some just little key points right here of topics that they can cover: your health matters, pharmacy, wellness. And then the logo is really non-existent because it's a page within the university's page. So they don't really have much of a logo to themselves other than that. And then we're going to go back to some of the effective external communications, promoting social media, upgrading it, saying 2 posts per week, some health facts, some upcoming events, and also more visibility for communication with the campus. Trying to get the student involved, let them know what's going on. And also posting flyers. I know everyone said that we do not like the flyers, but you do get flyers in your hand. You do look at it from time to time. Revamping the website. I know Evan over here, he was talking about the chat that we had talked about. I think that's a great idea. An easy way for students that are even off campus just to get a quick insight of what's going on. And increasing student involvement. I was thinking a 5K. I think a 5K would be pretty cool. I know we have a lot of runners on campus. I see them running around a lot. So that'd be a great way to get a certain group of students involved and to promote health and wellness. Also, just increasing events on campus. I was thinking doing like I know Campus Outreach, they do the big event where we kind of do like a little competition between other organizations. So I was thinking that would be a great way to get people involved, maybe even do some prizes, some awards. And one thing that I do like that the health center does is the flu shots. Now normally you just see the table sitting out on campus and you're like, okay, hit me with anything. But I was thinking maybe they should advertise that a little bit more, let you know the days that it's available for you to go and get it, because I think they could get a pretty big line going up. Any questions and answers?
Oh, yeah. In summary, what Collegiate Health Consulting Company wants to do is make your experience with your health center a lot easier, more accessible, and more fun. We don't want going to the doctor to necessarily be a bad thing every time, maybe just to be more aware of your personal health, make sure that you're healthy and that you're doing the right thing to take care of yourself. We want to make sure that the entire university is healthy, so a healthy university is a healthy youth. Do we have any questions?
If we wanted to get in touch with you after the presentation, do you have anything that has your information on it?
Yes, ma'am. We have business cards and takeaways for everyone.
All right, so this is Team 6. Are there any questions for Team 6?
How much time and effort will be needed for the recommendations?
PDA system, it takes about a month to install. We have to find the right locations to set it up and stuff like that. But these other things are pretty accessible to a phone, maybe to a laptop or something like that's digital. So it won't take long at all. Probably to get it really active and see it active. It may take a few weeks or some good promotion. But the only thing that will really take the most time is the PDA system to install. Other than that, everything should be instantaneously. Maybe take a day or two.
While we're working with the consulting company with Smart Choice for
Smart Choice is working with us. Like I said, we stated the credibility that we have. We have a lot of experience within this group, working with different companies and stuff like that. And so we pretty much have a confident hold on what we're doing. Especially Evan here, he's a really good leader. He really knows a lot about the company and we invested a lot of time into this. So we have a lot of history behind it and we work together. We've been doing this for a while now together as a group. That's why I feel like we should invest in healthcare consulting.
Yes.
what risks are involved with the user recommendation?
The only risk that you're gonna really have involved is maybe spending a little bit of money to get some things updated. I mean, like you said, the website needs to be updated, and then we're gonna have to install some things around campus to make things a little easier to use. But other than that, it is going to be all for the benefit.
And with spending money also, with my financing degree, we can work in budgets with you and also work to get you the good price for everything.
Why should we trust your recommendations to improve the department now and into the future?
Well, I feel like you should trust our recommendation because it's not about us, it's not about you, it's not about the money. We are all about the students. Like I said, I have a nephew that goes to the University of North Carolina. I have a senior son in high school, so I'm constantly thinking about him and what I would want for them while they're at school. And just that incident, like I said, with the kid having the asthma attack is why we do this and why we push forth the best efforts for the students. So I feel like that's why you can trust us. We're going to give you the best results to benefit the students, that they're satisfied with your department, and we'll keep you guys going.
All right, are there any other questions? Justin, did you have a question?
I don't have a sheet. Alright, how much time or effort will be needed to put the recommendations in place?
I can do those. So with the PA system, you're going to be looking at a couple weeks. You're going to have to hire someone to install it. But the other things, like I had suggested, would be the updates to the website, creating social media, and things like that. Those can be done almost instantly, and they can also be done almost for free. So you can get a current student to do that as an internship, something they can put on their resume. They're not going to charge you. They're going to do a great job, and it's not going to cost you anything. You're going to have it done within 2 weeks. 1 day to 2 weeks it's going to be done. You can make a social media page in 30 minutes.
All right, well, thank you very much, Team 6.